So, a day after Ghana's premier health institution, Kolebu Teaching Hospital, stopped admitting cholera patients, the facility is still dealing with high number of cases, especially referrals from other hospitals. By midday Thursday, the Kolebu Polyclinic had treated and discharged 30 patients and recorded one death, a 10-year-old child. This brings the total number of deaths to 10 as of Monday. Justice Forson's reports. Right, we'll bring you that story later. Let's talk about this all the same over the next few minutes. Dr. Asiedu Bekwe from the Ghana Health Service has joined me over the telephone. Thank you very much, Doc, for joining us here.
Thank you.
Have we identified what could be causing the repeated cases and the increasing number of deaths and cases as far as cholera is concerned?
Yeah, thank you. I think that the risk factors for cholera infection is still around, because basically you're looking at the bacteria. You ask yourself, is the bacteria so circulated? And the answer is yes, because it is people defecating in open spaces and then being carried by water sources.
Right, but Doc, I'm asking because we have gone all out to educate people on the risk factors like you have mentioned, but we are having repeated cases, not only new cases. My question then is, has the Ghana Health Service identified why, in spite of all the taxpayers' money we are spending on education, we are still having repeated cases in our hospitals?
Yes, I think that it's a different game, giving the education and people abiding by what you are telling them. Yes, I think that's a challenge, because you are telling people, it's like telling people that you should put on condom when you're having sex, and people don't do it. So it's a human attitude and behavior. And it's like some people, you tell them that the person who is having cholera is vomiting and passing feces, is like make sure that you avoid that immediate contact and the person gets to it. So it's a difficult thing, but we keep on trying to educate persons to make sure that you don't eat cold food. You go and eat it. You make sure that when you are drinking water, you are sure the source of the water. So it's an ongoing thing that we are trying to educate people, but it's a challenge.
In inference, what you're telling me is the fact that we are helpless at the mercy of cholera, because then people can't change their attitudes and the Ghana Health Service cannot do anything about it.
No, that's not what I'm saying. What I'm saying, telling you.
So I know what you just said. What can the Ghana Health Service do about it?
No, I think that when we talk about cholera, let's not narrow down to Ghana Health Service. Cholera is a very big issue. Just that is the end point or the end product that manifests as a disease. Because basically you are looking at water, you are looking at sanitation, and then when there's a malfunctioning of these systems, it manifests as a disease entity called cholera. So I think that our water situation must be looked at. The quality of food must be looked at. Then you are looking at also the end product, which is the disease. And then in that perspective, for our side, we are looking at two things. It's educating the people and managing the cases. That's clearly the mandate of Ghana Health Service. But then the issue is, if you end up getting a fatality, that's a death. Then the challenge comes when the person comes to the health facility. That's a challenge. Because ideally, for cholera, you can die within a matter of hours.
Doc, we'll talk about the number of deaths. Let's just stay on the cases for a while longer. All these things you have mentioned are the risk factors, as risk factors. Did they not exist in 2013 when Ghana did not record any case of cholera?
Yes, that's what I'm saying, that the bacteria must be introduced. When the bacteria is introduced into the environment, then you can have a disease. So if the bacteria was not introduced in 2013, you do not have the cholera.
Okay. So now when you say that we should take a second look at our water, we should take a second look at the ABCDs you have mentioned. I'm just wondering how it helps the situation, because then we are still recording high numbers of deaths. Recently, a health worker told us the fact that most of the deaths are coming from referrals from private institutions. Why? Because these private institutions do not have what we know as the drips that are given to cholera patients. Why should it be so?
I don't think that is the reason. It's basically, when you talk about cholera, it's about somebody losing excessive amount of fluid, and that includes electrolytes,
Okay.
potassium. So we have IV fluids that contain potassium that you give to the person. Normally, you give that when the person is vomiting. If the person is not vomiting, then you can usually give ORS, because the ORS contains the amount of water and then the electrolytes that you need to give to the patient. So far as the health facility has these IV fluids, and then you are giving the right quantity, monitoring the input and output, the person doesn't die. But the challenge is when the person comes in very dehydrated and very late, they are not able to attain that within that short period of time. So it is not that.
Okay.
The private
Now, here's my question. Do the private hospitals have those IV fluids that are meant to help people with who have cholera?
I wouldn't say it's total, but it's a mandate for a facility called a hospital to have basic things. And basically, for cholera management is free. So normally what happens is that the Regional Health Directorate makes a request, and then they get the needed logistics that includes these IV fluids from the Central Medical Store.
And so if right, go ahead, just complete that quickly.
So if you make a request, then you get it. So it is not a challenge that it's not there.
Very well. So, if these IV fluids are supposed to be free, and private hospitals do not have it, come to think of it, public institutions, which is our public health institutions, are running out of space to deal with cholera patients. The private hospitals keep churning out and referring patients to the public hospital. Yet the Ghana Health Service has not thought it prudent to give some of these IV fluids to private hospitals, especially in the cholera endemic communities.
No. You see, is it based on the fact that the private people...
Absolutely. The health officials have told us that the reason some of these referral cases come to them is the fact that you can only find these IV fluids in our public health institutions. And that is why most of the cases in that particular hospital, most of the deaths recorded in that particular hospital have come from private institutions that were referred there. My question is, why must we wait? Why can't we give the private institutions, if indeed cholera treatment, it is free?
I think that I don't know where we are speaking about a specific facility. Then that one can be addressed, because basically, you see, you need to, what we say is that you pre-position logistics, and then requests are made. So it is not that you are because look at Ghana, look at the number of health facilities. I mean, you are not so clear which, let's say, facility somebody will go. So if you are talking about specific, then it can be addressed. So I think that let's not make it generalized.
Oh, but Doc, come on. We are faced by an outbreak of cholera. We know the communities where the cholera situation is coming from. And there are private institutions in that hospital. Forgive my language. It's no brainer to know that we shouldn't wait for a request to be made. We want to save the lives of the people. It is the government's duty to save the lives of these people. Why won't we take the step, be proactive rather than reactive, and wait for these hospitals to come and request?
You see, that's what I'm saying, that you said you were told that the private facilities said they don't have the IV fluid. Yes, and that's what I'm saying, that I'm hoping this information will be addressed at let's say, at the immediate level.
I see.
Because I'm speaking now at the national. So I'm thinking that this issue can easily be addressed. But now you've said this. I believe we are going to look at this information. Because as far as you're concerned, the region hasn't complained about like ivory shortage.
But
let's not argue that. I mean, when you are interviewing somebody, do you get it? You are looking at, let's say,
let's stick to the matter.
Yes.
You still haven't answered the one most important question I have asked. I was asking, have we dealt with these private institutions? Have you tried to resource these private institutions or private health institutions for that matter?
Like which one?
To be
give me an example.
No,
give me
part?
One. Because if you are saying generic,
is it part of the plan? Because considering the public health institutions are running out of space to deal with the number of cholera cases that are churning out at those facilities, is a part of the plan to resource private institutions within cholera endemic communities to be able to deal with it.
Yes, it's part of the plan.
Have you done it?
Pardon?
Have you done it?
That's why I'm saying that. You see, let's give me an example of a locality that you said that's the issue. Then we'll look at it. Because basically what I'm saying is that...
In other words, Doc, it is part of the plan, but you haven't done it.
I won't say we have not done it, because you haven't given me an example where the area is. That you said
but I think it should be easier, considering we are live...
Give me an example of the facility, and then we're not specific.
Doc, just give me a second. Let me make one thing clear. Unfortunately, on the that said so. How is that possible? In fact, it is not ethically right for me to do that. You can ask me that off air. But if you can't answer my question, it is as well very fair that you do not want to answer my question. Then we can move on to another discussion.
No, listen. You see, we at a national level want the best for the circumstances. So what I'm saying is that the plan is when you have an outbreak, you get it. We try and give minimum stock of this logistic facility, and then their requests are made based on the usage. That is the plan. You get it? So if you ask me, I think there's a clear plan. So then I want to know how we can easily address that situation you're talking about. Maybe you can speak offline, because we want to make sure that the best thing is done. But there's a clear plan that you use and then you replenish. That is a clear strategy.
I see, Doc. Now let's just move away from that. I think we spent far enough, in fact, too much time on whether or not we should resource our private institutions, where unfortunately patients tend to as their first call, and the fact that our public health institutions are overwhelmed by the number of cases. How well is education going? In your own opinion, how well do you think education is going?
I think that the education, I would say it's an ongoing process. Basically, now we are looking at two disease entities, Ebola and cholera. As much as possible, we are using our health staff to get the whole message going. We have printed also posters, we have sent flyers to try and educate the public. And I think that even this your forum is also an avenue to get people to listen to the issues. But one thing which is clear is that behavior change is a very difficult issue to address. We are, as much as possible, trying to get people to stick to the do's and the don'ts. But it's a challenge. But we are still doing it, and we are also relying on platforms like yours to get education done. And I think that it could be part of your routine that every morning you try and send simple messages on cholera and Ebola to the general population. Because it is not a one-man thing. When you talk about disease like cholera, it's a multi-sectorial deficit
I
that
see.
needs to be addressed.
In other words, the Ghana Health Service will need help in educating members of the public.
Yes, it's a global thing. It's a national event. Like this Ebola, it
now
is not restricted.
let's turn attention to the overwhelming number of cases in our hospitals. How are we dealing with that? The fact that people, there are no longer beds to even hang IV fluids on so that patients can get their drips. So, some are being hung on threads, and people would have to lie in OPD and the likes. How are we dealing with that?
Yes, what is being done is that nearby facilities are being identified. You see, people have in their mind where they want to go for healthcare. But because of the overwhelming numbers, other nearby facilities are being identified so that they can be managed. I think management of cholera is not a very complex issue. It's about having access to IV fluids and the oral ORS. So nearby facilities are being identified. That if we get the numbers, then you are referred the nearby facilities to handle them. I mean, that's what we are trying to do so that facilities are not overwhelmed.
I see, Doc. We'll leave our conversation here. Absolute pleasure talking to you. Dr. Siedu Bekwe is with the Public Health Service Directorate of the Ghana Health Service. Now, let's look at the overwhelming nature of cholera in our country, especially as the country's premier health institution, the Korle Bu Teaching Hospital.
Ghana has recorded about 5,000 cholera cases since June 2014 with nearly 40 deaths. The Korle Bu Polyclinic remains the hardest hit, being a referral hospital. When Joy News visited the polyclinic, a new structure was under construction to help accommodate more cholera cases. This is in addition to the existing makeshift structure and the corridor, which has already been turned into cholera bay. The hospital said on Wednesday it has resorted to treating patients in wheelchairs. At 12 noon, the news team observed more patients were still being conveyed to the hospital. The disease controller at the polyclinic, Abigail Usu, said interrogation with the new patients indicated most of them are relatives of patients already admitted at the clinic.
The main problem we have is the relatives. The relatives whose patients are being detained, they come to the patients every day. When you drag them away, they will still come back. They think you don't want them to come close to the patients, but it's not like that. When they come, they just take the disease back to their house. It could be that the person will come back. If the person doesn't come, he or she will be a carrier, then he or she will be giving it to other people.
Abigail also said the polyclinic is currently organizing outreach programs to educate relatives of patients when they send them for treatment.
We talk to them, we show them what to do with the things they were using when they were detained. We tell them when you go home, put the water that you use to wash your things that you used here, you should put Dettol or Parasol in it, wash it nicely, dry it in the sun, and after iron it very nicely, and then you add it to your things. But they don't listen. So that is why some go and 3 days time they come back.
Some of the patients at the hospital shared the experiences with us.
Early in Monday morning, I brought my boss to the hospital here. Before around 6 o'clock, before I realized, I started all of my body just lose concentration. I'm vomiting, going to frequent toilet and those things all. And I said, okay, then I need to rush to the hospital. And I came here, all they could tell me is cholera.
The Monday evening, I bought a porridge at Zongo. So after taking the porridge, around 3 o'clock, I started running. So the first one, I thought it was just normal. After the first one, I decided to take water. After the water too, I vomited all the water. So around 3, 5, 6, around 6 o'clock, I died. I nearly died. Yeah, so I was carried to the hospital and I've been discharged for 56 trips.
A visit to the lab polyclinic also indicated the hospital is still receiving increased number of cholera cases daily.
But I still don't get why you and I will not change our attitude so that we don't get any episode of cholera in our homes. Is it so hard to observe personal hygiene? Is it so hard not to eat your food cold? Is it so hard to wash your hand after using the toilet? Is it so hard to wash your hand before eating? If you're not changing your attitude, you don't expect the government to do anything. Although I admit it is the right of government or the duty of government at the moment to make sure that not too many people, again, henceforth, die from cholera. I'm going to read a few of your messages on cholera, on the fact that the death toll keeps rising. Most of you are absolutely not happy about the fact that this is happening here in the country. And I'm going to say again, it's an absolute shame, total shame that we allowed this to happen. I'm wondering what we changed in 2013 that we can't do now. Anyway, now Mohammed Baba Azizi says it's our attitude and we need to look at it again. It's an attitude that has brought us this way. Let's keep our environment clean. And I absolutely agree with you. If you've had cholera, I think you should be ashamed of yourself and observe personal hygiene henceforth. You want to treat your family the same way. Foster Aldrich Owushu says, oh, Ghana, a disease which has a cure is even killing us. What if Ebola that has no cure comes in Ghana? We can all imagine what will happen. God save Ghana from this mess. Shatalina Ajiman says, cholera is killing Ghanaians, but the government has no plan to deal with it. What a country we live in. And Henrietta Louisa Nelson Kofi writes quite a paragraph. And I'm going to read just a bit of it. Just too disappointed that I had to take 9 deaths and an overwhelming number of cholera patients at Kolebu for a senior doctor to suspect sachet water. Field Marshal Abdul Hafiz says, God save us from this Ghanaian form of Ebola, which is the cholera, really. But it's all on us. We have a duty to protect ourselves too. Manasseh Kobe says, God forgive our sins and save us from this sinking boat. Meanwhile, Hakeem Nuruddin says, this disease can actually be prevented by our own selves, but complacency and carelessness on our side as Ghanaians keeps the numbers rising. Ghanaians have to be alert of the pandemic and we can easily prevent it. I'm going to end it at that. And I'm saying again, while we put pressure on government to do all it can to contain the cases that are churning out our public health institutions, it's also, the onus lies on you to protect yourself. Observe personal hygiene. That is not too difficult to do. My name is Kemini Nyamani Amano. When I see you at midday, we'll talk about whether or not Nigeria is making headway with Boko Haram with the latest development, and find out also if it's such a great decision that countries, in spite of the warning from the advice from the World Health Organization, are banning flights from Ebola-stricken countries. See you then.